The stigma attached to mental health presents many challenges for those seeking help. For young adults like Emily Murphy, taking the first steps in diagnosis and treatment methods can be even more difficult. Now, an online clinic called MindSpot is creating new treatment options that differ from traditional mental health counselling.
The real aim of the MindSpot clinic is to try to improve access to evidence-based assessment and treatment for people with anxiety and depression.
Professor Nikolai Titov is the project director of MindSpot. He has worked in the mental health sector for 25 years and helped create the clinic in 2013. The no-fee, easy accessible nature of the website has seen 40,000 adults register to use MindSpot in that time. This includes a large number of young adults like Emily. She developed her anxiety symptoms after returning from a 12-month exchange trip. Although she sought out a counsellor first, Emily says the MindSpot program offers her excellent advice, which complements her counsellor's work.
So about a week and a half ago, I signed up for MindSpot's Mood Mechanic course, and basically this gives you steps and talks you through the way to handle moods or emotions you may feel in public spaces when doing things that can trigger your anxiety.
For a university student like Emily, she is able to balance her online clinic course with her studies. The program that she has signed up to, the Mood Mechanic course, specifically targets 18 to 25-year-olds and can be completed in 8 weeks.
One of the main benefits for the Mood Mechanic course is that it gives people the opportunity to work a little bit more anonymously in that remote setting.
Rebecca Deer is one of the MindSpot program coordinators. With a background heavily focused on mental health counselling, she says the Mood Mechanic course offers the important first steps for young people in combating mental health issues.
To be able to sign up and work remotely from home in the comfort of a home environment and learn skills can be very comforting first step for people, especially that 18 to 25-year-old age group, when they are wanting to tackle those symptoms of anxiety and depression. The patients would log in and they would learn a variety of different skills to help them manage their symptoms. There's also what we call do-it-yourself guides and their homework guides. So after reading the lessons and learning the skills, they would then be given some homework guides that they could use and practice those skills throughout the week.
While counsellors like Rebecca believe MindSpot's alternate treatment options present a new direction, the consensus is they will not necessarily replace traditional face-to-face treatment. Many health professionals would prefer to only recommend online treatment for those with a mild mental health issue, while using face-to-face for more serious cases. Dr. Lisa Lampe, a clinical psychiatrist who lectures at Sydney University, agrees that the two methods should complement each other.
Looking at the MindSpot website, it did seem very well thought through in terms of the process, I guess, from beginning to end. It might have been nice if one could have seen a sample of the lessons. I think certainly, even as a therapist, going online to try to see what it might involve for my patients, I would have liked to have been able to see perhaps a sample lesson or a little bit of a lesson, and that might be something that I think would be useful, because it did seem that you had to sign up for the whole process and the assessment.
Rebecca says MindSpot and its programs have significant advantages, allowing a less confronting environment.
Patients can practice the skills in the comfort of their own home and sort of in the privacy of their own home as well. It means they are able to be a little bit more anonymous, and sometimes that creates a lot more comfort for patients. Seeing someone face to face at first can be a little bit confronting.
For Emily, the MindSpot course has provided her with skills to help her in stressful situations. She even uses the MindSpot steps to help her cherish the simple things in life, like getting her hands on some Maccas.
This morning I went to McDonald's. I was able to order just by using the steps given in the mood maps. And it worked perfectly. I didn't feel anxious, I didn't feel nauseous, I was able to successfully order McDonald's, which for most people, not a big deal. For me, that was the greatest McDonald's ever.
This is Harry Easton, reporting for Tightrope.